First of all, I want to thank everybody that's here. I literally handpicked every individual that's sitting here. So if you don't know the person that's sitting next to you, make yourself acquainted with the individual because everyone that's in here is here for a reason. Appreciate y'all coming and taking your time out. I'm Chad Cino Roper. I have a nonprofit called Dreams Never Expire, and we have partnered with Advocate Aurora Health on a men's health series. My partner Mario Brown and I, we've done a podcast with them first. We've interviewed doctors in the Aurora system speaking about health in the communities of color. What can we do better as a community of color to make ourselves healthy? You can have as much money as you want, but wealth, when you speak of wealth is every area in your life being fruitful. That means your health is good, your relationships are good, your revenue stream as well. So that's what I want to talk about, and that's what I want to teach this community. Obviously, I have you guys here because you guys understand that already. And I want to get some perspectives from people, from heavy hitters of the city of Milwaukee. So that's why I have the different individuals sitting here right now, from all age, from younger to more seasoned individuals like myself. So thank you guys for coming. Mario?
Yeah, appreciate you guys. Thank you all for coming out. Y'all could be doing anything else, and you chose to come here tonight. So we pray that something that's said will, be impactful tonight. I'm Mario J. Brown, originally from the city of Milwaukee, living in Atlanta now. National recording artist, singer, songwriter, and Chad and I, we just thought that we wanted to utilize our platform. We've both been in the music industry over 25 plus years. Some of you may or may not know some of the people that we work with in that course of time, but throughout the time, our platforms have, grown. And so we want to use this as an opportunity to just be able to give back, to speak back to the people that follow us, the people that look up to us. Like you said, OG, believe it or not, me and Chad the same age. I know he's way older than me, but so we just... He said that because I son him all the time. That's why he's my son. Yeah, so we go way back, brothers. Godfather, my son, and I love him, of course. And we just take this opportunity just to bring this platform to you guys, to be able to have real conversation amongst brothers, something that we don't do often, and we need more of. Absolutely. So, we have a very special guest today, Dr. Hampton. Y'all can make it give some noise for Dr. Hampton. I want to just read a brief bio about Dr. Hampton so you guys have some insight on his expertise. Dr. Hampton is especially passionate about removing barriers to health and equipping his colleagues with the education and resources they need to take charge of their health. He is also an ambassador for the Advocate Care Center, a place where patients receive multidisciplinary care in one visit. He is one of less than 5,000 board-certified obesity specialists. That's huge, working with patients in the clinic with small groups enrolled in diabetes prevention. And he comes all the way from Chicago, Illinois. So without further ado, Dr. Hampton, thank you for joining us.
Yeah, thank you guys. This is what it's all about. And before I even say anything, I want to ask all the men, how many of you guys have kids? All right, so more than half of the hands went up. And so I say that to say, I'm really not here for you. I'm not really here for me. I'm here because we have kids, right? And we got grandkids. And so everything that you hear tonight is about figuring out how do we have more time on the planet for them so that we can coach and lead them and be here for them. So that's what it's really all about. I'm passionate about wellness. I'm passionate about obesity, medicine, helping to resolve that, diabetes, and something called metabolic syndrome. So I'll explain that later. But I just want you guys to understand, you don't have to be sick. You don't have to be ill. There's very simple things you can do to be healthy. And it's really not painful. In fact, you'll feel better. We're here late at night, but yet you can feel good being here late at night because if you take care of yourself a certain way, you'll heal. And all those chronic illnesses won't be your destiny.
Dr. Hampton, question right off the gate. What made you start on this?
I'll focus on how I got into lifestyle. And it started with my wife. When she developed type 1 diabetes, I was you know, she looked at me and said, I'm scared. She's a pharmacist, and yet she was fearful because she knew I don't want to have to stick myself every day, right? So she looked at me and said, you need to help me. And I'm like, I'm a doctor, I'll figure this out. But I realized that what I was really good at was managing chronic illnesses with prescriptions, medicines, and surgeries, and suppressing symptoms. As I did my research, I realized, oh my God, you can actually heal and reverse disease, but you can't do it with procedures, surgeries, and medicine. So as I tried to help her, and I learned a lot doing my own research, I figured out that not only can I help my wife, but I can help my patients. And then when I shifted from disease management to reversal and healing through nutrition and lifestyle, I started taking people off of insulin. I started taking people off of blood pressure medicines, and I was just as shocked as my patients were. So my passion right now is to reach as many people as possible to help them understand, again, like I said earlier, you don't have to be sick. You just have to learn these simple principles. And if you learn these principles, you'll be able to, kind of have energy, be here for your family, and that's what kind of really makes me passionate. So I'm trying to scream from the rooftops that there's a better way, and hopefully we'll reach more people, particularly in communities of color where there's so much chronic illness.
Absolutely. So how important would you say it is for us to have routine checkups?
Man, routine checkups, okay. So you'll always hear from the doctors, you need to see your doctor for health maintenance checkups, right? My goal is to help people optimize themselves. So if I get a person in front of me who's pretty healthy, but yet they want to be healthier, like for example, if I make it personal, this year I want to get better at meditation. I want to spend some time in sauna so I can detoxify. We didn't even learn the term detoxify in medical school. And I want to be able to do some things like massage. So I want to optimize myself. Now, when it comes to health maintenance for me, it's about identifying what are my weak spots, what in my family history makes me vulnerable. And then once I identify that, then I say, well, let's just say dementia's a thing. So what do I need to do to prevent dementia? Then the next thing you do is what kills most people? And so you think about heart disease, stroke, cancer, dementia, right? And then you say, well, what do I need to do to mitigate those risks? So when you think about health screenings, it's really about figuring out where I'm weak. And I used the term earlier, metabolic syndrome, metabolic dysfunction, which basically talks about blood pressure, blood sugar, your waist circumference being bigger than it should be, your triglycerides and your HDL, that's the cholesterol stuff. If you have three out of 5, that would mean